Hi, my name is Purab Patel and I'm a second-year medical student at Nova Southeastern University. This presentation is on the modeling of adverse ventilatory effects of nasogastric catheters in neonates. Nasogastric catheterization has many indications ranging from feeding to gastric lavage and is widely employed in acute care settings. Neonates in particular have a restricted upper airway anatomy, and this creates a risk of airway obstruction when nasogastric tubes are used. Nasogastric feeding has been shown to reduce minute ventilation, tidal volume, and oxygen saturation in neonates, amongst other key ventilatory parameters. However, a quantitative comparison of different sizes and types of nasogastric catheters and their effects on airway resistance has yet to be performed, and this was one of the aims of this current study. Through this, we hope to create some guidance on better sizing and selection of nasogastric catheters in order to minimize some of the adverse effects that have been reported in the literature. To achieve this, an MRI for 37-week neonate was used to 3D print a 1:1 scale upper airway model, as seen in Figure A and Figure B in the middle panel. Figure A shows the internal geometry of the airway, while Figure B shows the external test apparatus, including the various sensors, as well as the nasogastric tubes as they were inserted. 5 different test configurations were used, including a baseline in which no nasogastric tubes were inserted, single or dual 6 French catheters, and single or dual 8 French catheters. For the dual catheter configurations, 1 catheter was placed in each nostril. Medical air was then passed through the model at gradually increasing flow rates, and the flow rate as well as the pressure at the level of the laryngopharynx was measured by sensors. Each test was performed threefold in order to increase reproducibility and allow for calculation of confidence intervals. Linear regression analysis on the pressure flow data provided the total airway resistance generated by each of the catheter configurations. The results indicated that all of the catheter configurations tested resulted in statistically significant increases in airway resistance relative to the baseline, and in particular the dual 8 French catheters produced an increase of 3.01 centimeters of water per liter per minute of airway resistance relative to baseline. This represented a Z-score of positive 651, or a 78% increase relative to the baseline. The summary data is presented in Figure C, which shows the total airway resistance for all of the catheter configurations. The conclusions of this study are several. Firstly, that nasogastric catheterization measurably increases the airway resistance, and this warrants special attention in the neonatal population. The imposed resistance also varies considerably with the number and size of catheters placed, and the relationship is not necessarily linear. For example, the dual 8 French catheters showed a disproportionate increase in the airway resistance compared to other catheter configurations. These findings have several implications. Firstly, they provide some guidance on better sizing and selection of nasogastric catheters, for example, avoidance of more obstructive catheter choices such as the dual 8 French catheters. The findings also may help explain some of the ventilatory findings that have been reported in the literature with nasogastric catheterization. In the future, translation of this work into a predictive software model rather than a bench-based model can allow for rapid and individualized bedside selection of nasogastric catheters in order to maximize patient safety by minimizing airway obstruction. Thank you for your attention.